mind coming up here?
Hi, Mr. Collins. We're going to have you speak into the microphone so that we can find out a little bit about your pain.
1967 Vietnam landmine.
Okay. So lots of cuts and...
Lots of cuts, lots of abrasions,
okay,
lots of shrapnel.
So that is 30-some years. How has that limited your life?
Oh, completely. I mean, it's taken away, you know, all my physical traits, and so...
And so you
they
obviously...
actually told me that I wouldn't walk again.
Oh, wow. Well, you're doing a pretty good job at that. So you've
But
come a long
it
way.
hurts,
Okay. How does that pain inhibit you doing a normal life?
Oh, everything.
What can you not do?
I'm in pain 24/7. So.
Okay. And so you obviously then have to take medications.
Right. Lots of medications.
Lots of medications. Okay. And how does that then affect your life?
You'd have to ask my wife. Not very good. Not very good.
Okay.
That's why I'm here trying to get off this stuff.
Okay. And people have weaned down off pain medications because once you get the pain down, and by the way, your medications usually will not interfere in the working of the patches. Okay. So that's good. But we're also going to put glutathione immediately on him because 30-plus years of pain medications, every single medication is a toxic chemical. They build up in your body. In some of the studies we've done on the glutathione, we have had people taste anesthesia from using the patches. They haven't had surgery in 5-10 years. But they're tasting the anesthesia that's stored in their cells coming out as a result of increased glutathione. We had one man who was in one of our studies who hadn't smoked in 30 years, but he could taste nicotine and his BO smelled like cigarettes while he was on the patch. So we store this stuff, and that's part of what ages us and makes us ill. So do you feel anything there in holding it?
No.
Most people don't. So
Good.
yeah. It doesn't mean it's not working because it is already working.
I used to smoke.
Oh, did you? Okay. So now if you get a taste in your mouth, I want to hear about this.
I have a taste in my mouth.
Right now?
Yeah.
You didn't have it a minute ago. And what does it taste like?
It's almost like a bacterial. It's strange.
Okay.
It's like an anesthetic.
Oh, yeah. Here. It speaks
anesthetic.
like, like anesthetic?
Yeah, it's like when they put you to sleep and they hit you with the Valium and it just, your head goes bright.
Okay, and you can taste that?
I can taste that.
You're having any mental changes right now?
Right, I can feel it.
Okay, this is very typical of what happens when we use the glutathione patch. He is detoxing already, and that's good because the toxins get in the get in the pathways of the nerves and other functions of the body, and they block it from functioning correctly. So that's why I know with his history of 30-some years using pain medications and having numerous surgeries and so on to help him with his wounds, that he has toxins in his body, and that increases pain. So,
would you like me to hold these for you, or do you
no,
decide to stick tape?
I've got tape.
You're ready.
I carry tape with me. It's always in my purse, and my patches are always in my purse.
I've had 40-plus surgeries in the last 30 years.
Oh, my.
54.
Oh, his wife knows it's 54. She's counting. Oh. Well, of course, yeah.
Memory patch?
Well, you watch.
Yeah.
Because one of the things that blocks our mental function is toxins. So one of the effects that we do hear from people is with using the glutathione patch, they have increased mental capabilities. Now, if you think about Alzheimer's and some of these other mental conditions that old people get, senility, they are associated with heavy metals.
I thought that was a band.
It is.
All right.
All right, now tell me where your pain is, the worst spot, because you probably have multiple places.
Oh, absolutely, all over. But I just had a wrist replacement about a year ago.
Okay.
There's a prosthesis in there, and it hurts 24/7.
And point to it with your finger there.
In here.
Okay. Now, what I've found over years of using these patches is, this is old pain. I can see a scar, but it's not fresh. So this is old pain. So I will
This is an
put.
old man.
Yeah, really. And being patched by an old lady.
Yeah.
But not an old patch. So I'm going to put the white patch on the point of pain because I've found that the white patch puts energy in. That means this is a deficient condition if it's old pain. Or I bet cold hurts it,
Oh,
doesn't it?
absolutely.
That's another clue. It's old, cold pain. It needs a white patch. So, oh, I forgot to ask you what the pain was. The pain level. Darn it.
7.
A 7-ish. Okay.
Yeah.
Any change yet?
No.
Okay. Now I'm just going to go for a guess, and I'm just going to put the tan one underneath and kind of like get the signal through the wrist area where he has pain. Now, can you bend it and make it worse or anything? Does anything make it worse?
Cold.
Cold makes it worse.
Your hand's cold?
No, not really. Moving it make it worse?
Yeah, if I had a paintbrush.
Oh, okay. Well,
Yeah.
pretend.
Okay.
Okay.
Yeah, that hurts.
Okay, and 7 level?
Mm-hmm.
Okay, so that's not doing it. That's not reducing it at all. So what I do is I leave the white one there, and I'll put the tan one like up here. We'll see if that works. On the website, under IceWave, there is a tutorial that tells you how to patch people using the cross method. We call it the Haltenwanger cross because Dr. Haltenwanger discovered this after doing events like this and being like Nicholas told you, they're up there in Las Vegas with thousands of chiropractors walking by the booth and they're patching people up, and they became very good at finding the best place for the patches very quickly because you've got so many people.
That helps.
How much?
I'd say it reduced it to a 4.
Okay, so that's about half. Let's just try. Now we're getting good results, but I'm kind of one that pushes the limit. So I'm going to move away and have him test it.
It's better.
How much?
Probably another 2 points. I'm probably down to a 2 or 3.
Okay.
Yeah.
Oh, no, nothing going in.
Now, yeah, there is nothing going in his body. In fact, the brown patch is on his sleeve. I have not taken the back off, so they're really technically not even touching his skin. I've taped them on temporarily because I want to move them around until I find a good spot. Now, most people could live with a 2 pain. Would that be you?
Yeah.
Okay. That, I would say, would be a successful demonstration.
I think so, yeah.
Now, he can then take and put these patches on permanently where he has now opened up the pathway that's blocked. This will also then help to heal. The body will be able to take nutrients in and help heal this because obviously something's wrong. It still hurts after how long after the surgery?
2 years.
2 years. And he's still in a 7 pain. A 7 pain is pretty severe. 10 being the worst, you know. Okay, I think,
All right.
Don, now what I want you to do also then is to be able to apply these to the other areas of your body. Now, he may get a total body effect from these 2 patches. So maybe later tonight you can give us some feedback as to how the other painful places in your body are.
Sure.
You may get improvement just by patching up your wrist.
Okay.
It sometimes happens. And then remember, you've got the glutathione patch
All right.
in your hand. That is immediately detoxing the entire body. Because again, the signal is there, the body picks it up. If it needs glutathione, it makes glutathione almost instantly.
Very good.
How do you feel?
Great.
Okay, well, thank you for demonstrating. Now, he has a limp, it looks like, so that's probably the next place that I would go with patches is to try and reduce whatever's causing the limp, because you've got to be active. We are a very sedentary society, and that's part of why we're getting sicker and sicker. So I always try to go for movement, especially lower limb movement, to get you so that you can take those long walks again or play golf or whatever it is you want to do to stay active. Bet you haven't played golf in a few years, have you?